And we are live, Senators.
Okay, so my touch screen.
Ooh, yes. Now that I know it's a touch screen.
Okay, good morning. This is the Senate Health and Welfare Committee, and it is May 6th, Friday, one of those good days of the week. And this morning, Jen, we're going to go back to look at H353. We had a draft from you yesterday, and that's the draft that we're going to stick with. We know our time is extremely short, and also we've worked hard on this particular proposal. So yesterday there was a suggestion about taking section 4 and putting it into a study, but I think that becomes very complicated at this stage of the game. And I'm going to suggest that we stick with the draft that we have. It's 4.1, isn't it?
It is.
Okay.
So just for clarification, has there been any drafts? Is this the draft that you took us through last Friday, I believe?
No, it's what draft I took you through yesterday.
Oh, I wasn't here yesterday.
Oh.
Shoot. Okay.
Let's go quickly through the sections, just the higher level.
4.1.
Yeah, so it's actually, I believe I have a 4.2, because I think I made a couple of word changes, or I will need to make a couple of word changes.
Do you mind giving me that?
Let's see which one. You have 4.1 posted, and I am, yeah, so there were a couple of,
Oh, shoot. Did it not? Sorry, Jeff.
it's okay, no, it's good, it gives me a minute to make a few.
All right, I'll print it in the other room. Thank you.
Okay, are we going to go through the bill, or are we doing something else?
We are going to the bill, I'm just gonna need to make, apologies. I was unclear on where things were going, I still needed to make, new adjustments, so. Maybe I did already.
Well,
Oh, that's what I had changed, okay, that's right, so yeah, so it'll be ultimately it'll be 14.2, but the changes are extremely minimal. And have to do
You know, I
with
was
the type
just
6.
gonna- This popped up in my email last night. It's from a woman in Rockingham who said she was, I received a voicemail that I think was from your office asking me about my experience at Brattleboro Memorial Hospital. Please feel free to call me.
I don't know what that is.
Does anybody know? I told her I don't have an office and I didn't call anybody.
Okay, join the club.
Nobody, we haven't got any kind of a state assessment going
I
on.
don't know what's going on there. You know what, our internet was down last night, so I couldn't look at anything in email, just got here.
I know it is.
We have to get out of here because it's so hot. So
We can open the door, but doesn't.
Yeah, open the door, will probably be good.
We have to start opening the windows when
Yeah.
this thing's on.
Okay, so Jen.
Okay.
Upper level,
Thank you for your
go
patience.
through, and then we'll, this will be 4.2.
4.2, because I had to change that word finance to financial and added in or PBM in a couple of places in that round back.
But if I looked at 4.1, that's basically it.
I think if you looked at 4.1, that's basically it. Okay, so for the record, Jennifer Parity, Office of Legislative Counsel. Section 1 is the intent language about making prescription drugs more affordable and accessible and stabilizing and safeguarding against the loss of more independent and community pharmacies. Section 1A requires DFR to monitor the cost impacts on Vermont consumers of the PBM regulation in various places in the statutes and recommend appropriate modifications as needed to promote healthcare affordability. Section 2 is amending the chapter on PBMs, and these are, for the most part, provisions that have been in here throughout. There is a definition added of PBM affiliate, which is added in a couple of places, and then that term gets used to ensure that there is not steering of business directly to the PBM affiliates. and away from other pharmacies. So there's the sections on the required practices for PBMs with respect to health insurers and covered individuals, which is building on existing law. There's also PBM required practices with respect to pharmacies. And some of that addresses the gag clause language. Oh, I thought it was an odd sticker for Senator Cummings.
I couldn't read it. What was on what's on TV on my desk?
All right. And then there is some language about 340B programs. One of them is extending, in the sense, the extension of the sunset occurs later in the bill, but extending language about some PBM practices with respect to 340B drugs and 340B covered entities. Then we have section 3, which makes some adjustments to the pharmacy rights during an audit, which is a fairly extensive existing section and statute that this makes generally some additions to. Section 4, which is the one we've spent a fair amount of time on, has some,
Wait,
yep.
Can you slow down? What page? Because I'm scrolling through.
Okay, I'm now up to page 17.
Okay.
All right, so then we have definitions, the definition of PBM affiliate again, and definition of prescription drug or drug. It's a quite broad description to incorporate really all things we would consider prescription drugs, including biological products and the so-called specialty drugs. And then there is the parity provision for retail pharmacists, reimbursement with respect to quantity of drugs and day supply of drugs, parity for retail pharmacists, with any other pharmacist or pharmacy, including mail order pharmacy or PBM affiliate. Then we have the language about allowing participating network pharmacy to perform all of the pharmacy services within the lawful scope of the profession of pharmacy. Some prohibitions on health insurers and PBMs as far as what might be in the plan for the covered individual and where they can fill their prescription. And then there's 3 and 4 are the white bag first, or brown bag first, and then white bag provisions, and 5 says it does not apply to Medicaid. Then section 5 is the DFR report. So it's asking them to look at a number of things around PBMs and pharmacy benefit management. Also collaborating with the Board of Pharmacy on whether there should be changes made to the board's rules about which pharmacists and pharmacies can do certain things. And then there's a catch-all at the end. If there are other issues relating to PBMs, then that would also be within the scope of the report, and that would, the findings and recommendations would come in by January 15th of 2023. And we have the applicability section that gives 6 months for anyone who is is already acting as a PBM in the state on the effective date. And we do need to make one more adjustment that I realized yesterday and was dealing with separately. So then that's in the effective date, but gives people, those existing PBMs, 6 months to come into compliance. Section 7 is the extension of that sunset on the 340B language in your existing law. And then effective dates, I realized that you have the, it had been July 1st with except for one provision that's going to be January 1st, 2023. But you have the DFR report in here that you're going to need to have take effect earlier than that. So I think you should, and I think there are certain provisions like the intent section that can also take effect on passage. So my recommendation would be to have sections 1A, 2, 3, and 4 take effect on January 1st, 2023, and everything else take effect on passage. That would be the intent, the extension of the sunset, the applicability provision,
Okay.
and which maybe we'll specify there as well, that they have 6 months from not just the effective date, but from January 1st to come into compliance. So
So
it got a
basically-
little more complicated there.
Basically, the language that's in here, I think, just scrolling through it quickly, is the language that prior to the blow up yesterday was the language that OPR and DFR had agreed to. Is that correct?
Yes, I believe that is correct.
So can we vote on this pending the date changing, notation, date changes?
If you're comfortable with it, I can tell you what I'm doing. I'm putting in the applicability section, I'm putting in, instead of in two places, it says effective date, I'm putting in January 1st, 2023, in both places. And then I'm changing the effective date itself to refer, so that the substantive provisions on pharmacy benefit management would take effect on January 1st, but all of the rest of the pieces, both starting the report and, setting the report in motion and the intent and the effective date section would take effect on passage.
So those are pretty technical corrections.
I think so, as long as you're comfortable with that, or
And now, if doing that, how long does it take to change it?
I'm doing it right now.
Okay, let me do that. Then I'll have draft 4.2 to look at. We have two things on the floor today. One is the resolution and the other is the further proposal amendment on 285.
That's nice.
And we have S90 that you're taking care of that, right? Because we did talk about that.
We're just gonna concur with that, right?
Yeah,
I missed
yeah.
that.
Yeah,
But
because we
yeah,
talked about that last week.
okay.
whenever it was. Time is fused. There's
Yeah.
fusion going on.
Just putting all of the
Alex, why don't we just go off live for a minute while Jen